Vitamin E is the most common antioxidant used by clinicians. A group of tocopherols are named as vitamin E. There are 8 tocopherols like alpha, beta, gamma, delta, etc. Among them, alpha tocopherol is the most abundant and potent tocopherol in vitamin E. Today I'll tell you what is vitamin E, what are the sources of vitamin E, what is its function, and what is the importance of vitamin E in our body, and lots of important information about vitamin E. Hello friends, as you all know, our body cells are damaged by free radicals in different diseases. So we use antioxidant to protect our cells from free radical. Vitamin A, vitamin C, vitamin E, these all are antioxidants. Vitamin E acts by protecting polyunsaturated fatty acids and unsaturated fats in our cell membrane and coenzyme Q, etc. from damaging by free radicals. And it acts as scavenger. It oxidizes itself so that PUFA can be protected and it is not damaged by free radicals. The daily requirement of vitamin E is 10 milligram in man and 8 milligram in case of women. Usually vitamin E is not damaged by cooking, rather it is damaged during refining of food. So we doctors advise not to take refined food. The normal blood level of vitamin E is 0.5 to 0.7 milligram per 100 ml. Wheat germ oil is the richest source of vitamin E. Other sources are corn oil, sunflower oil, safflower oil, cottonseed oil, soybean, then meat, milk, butter, spinach, nut, and lots of fruits and vegetables also contain vitamin E. Vitamin E is absorbed from the intestine and taken up from the chylomicrons by liver. The level of vitamin E is increased if there is increased intake of PUFA. Vitamin E is essential for cell membrane integrity and stabilization. It protects red blood cell from hemolysis. Vitamin E also enhances heme synthesis by enhancing some enzymes in the body. Vitamin E protects our germinal epithelium in gonads for proper reproductive function. Vitamin E protects PUFA. It prevents oxidation of vitamin A, and it is also essential for cellular respiration as it stabilizes coenzyme Q, which is necessary in cellular respiration. Vitamin E is necessary for nucleic acid synthesis. It is also helpful in absorption of amino acid. It is required for proper storage of creatine in skeletal muscle. Vitamin E protects liver from damage by lots of toxic compounds. It is recommended in lots of chronic diseases and ischemic heart disease. As you all know, selenium is a mineral which is found in glutathione peroxidase, which is an enzyme which protects the body from free radical as it destroys the free radicals. Vitamin E acts synergistically with selenium to protect our body from free radicals. There are no deficiency disease of vitamin E in human being, but there are lots of diseases where we can find low level of vitamin E which lead to lots of symptoms in the patient. Vitamin E deficiency is found in prolonged malabsorption syndrome like celiac disease or small intestinal resection. In case of children, if the patient is having cystic fibrosis or cholestasis, vitamin E deficiency can occur with symptoms of arefluxia or hemolytic anemia. Patient with A-beta lipoproteinemia cannot absorb or transport vitamin E, so their vitamin E deficiency can occur. There is a familial deficiency syndrome of vitamin E which is not well explained. Vitamin E deficiency can be established by blood test, and the level of less than 0.5 microgram per ml is considered as vitamin E deficient. Vitamin E deficiency can be treated by 800 to 1200 milligram of vitamin E per day. In case of A-beta lipoproteinemia, the requirements might be high. Patient need to take 5000 to 7000 milligram of vitamin E per day. Patient who is at risk of developing vitamin E deficiency should be given a supplemental dose of 10 to 30 milligram of vitamin E per day. G6PD deficiency patient, as you all know, develop anemia. In those patients, if we give vitamin E, erythrocyte will be less fragile and there can be improvement of the patient. The risk of retrolental fibroplasia in infants who are exposed to high concentration of oxygen are at less risk of developing this if we give vitamin E to these infants. Large doses of vitamin E can be given in patients with intermittent claudication and in fibrocystic disease of breast. In nocturnal muscle cramp, those patients might improve with vitamin E. It is also used in recurrent abortion, in sterility, in patients with menopausal syndrome, in ischemic heart disease patient, in lots of chronic diseases, in cancer patients who are protected from damage of body cells by free radicals or cancer, and we can use it in lots of liver disease to protect the liver. In neurodegenerative disease also vitamin E is very helpful. In case of post-herpetic neuralgia, vitamin E can be used. High doses of vitamin E, like more than 800 milligram per day, it can result in interference with platelet aggregation and interference with vitamin K metabolism. So it is not to be given in patients who are on warfarin therapy. So friends, that's all about vitamin E. I have told you about what is vitamin E and what are the sources and what are the importance of vitamin E in our body, what are the doses we should take vitamin E. So that's all for today. Thank you for watching.